Welcome back to Your Health Matters. My guest today is Tony Harris, Director of Respiratory Services. Hi, Tony.
Hello.
We're talking about the sleep lab
Yes.
and the different CPAP studies, and you're talking about daytime studies now.
They're called PAP naps.
Okay.
And we started doing it, like I said, a little while ago, and we've really found it's been beneficial in assisting our patients to be more compliant with wearing their CPAP and BiPAP machines.
And it doesn't work if you don't wear it.
Exactly. And that's really our goal, is to make sure everyone is comfortable enough, and their machine and their mask and their equipment is all working properly for them.
Because there's lots of different types of masks.
Yes,
Lots
there
of
is so many more, which kind of leads me to our new thing we're doing. We're taking it a step farther after the daytime PAP naps and sleep studies to also, starting November 1st, we're going to start actually doing setups for CPAP and BiPAP for actually the sleep therapy equipment out of the sleep lab in that area.
Okay.
It's still kind of separate from the sleep lab because I have a new supervisor for that.
Okay.
Basically, CPAP and BiPAP machines fall under DME, which is durable medical equipment. And it's kind of like the same kind of concept of wheelchairs and walkers and all that. It's all durable medical equipment.
All of the things you need if your health isn't 100%.
Yes, even hospital beds. But we're going to focus out of the sleep lab. We're going to have a sleep therapy kind of equipment set up, and we're going to have we have a new phone number, a new supervisor. Jimmy Cabrera is our supervisor, and hopefully once we get up and running, he can come on the show and talk more about.
Great, we'd love to have him.
We're going to be able to use the two primary manufacturers of CPAP and BiPAP machines is Respironics and ResMed. So we're going to be able to have supplies for both types of machines. So if somebody comes in for a PAP nap and there's an issue with their machine, we'll hopefully have that part available to them.
Be able to fix it or take care of it right then.
Yeah, take care of it. And then
nice.
We're going to also carry both kinds of masks. We're going to carry Respironics mask and ResMed masks to basically, even if we don't have it like right there, if people call in and let us know, hey, we need this, we need that, we can usually get it for them within a short amount of time. And our goal is once a patient is identified with having a sleep disorder, then touching base with them, and everyone has a choice. I mean, we have some great companies in town. We're not trying to take over for them. We're trying to augment the service, because Stat Medical's fabulous, and Uptown Drug, they do a great job. Basically, what we're going to do is just be another service provider, because people always have choices. So if they feel comfortable and they want to, they can now come to the sleep lab during the day and actually get their equipment, get set up on their CPAP device, their BiPAP device.
So it wouldn't matter even like if they moved here from out of town and already had a CPAP, it doesn't matter that they didn't get that originally from you.
It has nothing to do with who gave them the machine or what time machine it is or mask. We can usually get any of the parts and pieces or different kinds of masks. And a lot of people don't know, which we're going to provide information to a lot at the fairs, that depending on the type of insurance you have, there are, like, you can get a new mask every 3 months. You can get a new humidifier, and people that have these machines know kind of what I'm talking about. Every 6 months, filter, especially in this dusty environment, it's really important you change your filters in your machines out.
I keep forgetting to do that. I know I'm really bad.
Well, we're going to carry them. Out of sight, out of mind. But it really, the function of the machine is very dependent on making sure that filter's not clogged.
Okay.
Make sure that, the heater chamber isn't, growing mold. Different things like that. So it's important to make sure that all that equipment is working, functioning, and it's clean. And it the tubing itself gets replaced can be every 3 months.
Okay.
So it's kind of nice to know that you have that availability, and you don't have to, you can pretty much go to us or, any of these places. You don't have to have purchased your machine from us.
That's good. Or come in and get all new equipment.
Right, because I actually just ran into a woman on an inpatient basis that had a Respironics machine that was 30 years old.
Oh my.
So these machines, if you take care of them, can last you a long time.
Wow.
The bigger issue is ensuring, though, that the pressures are correct for you, that, you know, you understand that the masks don't, you know, they don't last forever.
Right, right.
Especially, you know, cleaning them helps, you know, kind of breaks them down a little bit. So making sure that you get that new mask when you can, so you're not, you know, so everything's working properly. So, but you can, you know, some insurances you can get a new machine every 5 years. Because the machines do improve.
Sure.
They're more comfortable. They're quieter. Now they're so tiny you can literally travel with them.
I'm on my second one now.
And it's really nice.
Half the size of my original one.
I have several friends that wear them, and I have a girlfriend I travel with a lot, and I wouldn't even know she was wearing her CPAP, but it's so tiny, and she wears it every night faithfully, and she's a respiratory therapist.
Yeah. Oh, well.
Yeah. And so she knows the benefit of wearing it and being very compliant with wearing it. So but I can't even tell, and I share, you know, hotel room with her, and can't even tell that she's wearing it.
My husband talks about all the time that it's there's like almost like a white noise. It's so quiet, and it's just that little bit. And he said it's a whole lot better than my stopping breathing in the middle of the night.
Yeah,
that always
wake him up and scare him. Yeah. So it's funny how that works.
If people have questions, they want more information, number they're going to call
is 928, so it's a local number basically, 263-3911.
Super. Okay. So
and that's a direct line to Jimmy's phone, and Jimmy's our new DME supervisor, and he will be able to assist them. We officially open November 1st, but you know,
right
anytime, it's a couple weeks away. Pretty much any question anyone has, we are there for them. We've had several people stop in that had machines set up in other parts of the country, even into our sleep lab. And this is before we actually even started. And this actually kind of gave us the idea of doing CPAP and BiPAP setups out of the sleep lab. Is we had a lot of patients, there's a sleep lab. So they'd come in and say, hey, this isn't working. What can I do for this? And then that kind of like promoted over this last year, building these other services and adding them on to, you know, be able to provide the best services possible for the community.
That makes sense. We were talking about then that the insurance covers most of that, but do they need a doctor's referral?
They do.
To come in?
Yeah, basically what happens, what happens is Dr. Matheny reads all the sleep studies out of our sleep lab, and basically he'll identify what the problem is. That report goes back to the referring physician that actually referred them to the sleep lab, and then that physician should contact them. I mean, at any time, I think if they have a question, you know, about their sleep study, they can always recall the lab if the lab's done it to ensure the physician did get the report if there's any question. But we do religiously, as soon as they're read, we fax them to the referring physician so they do have that information. And then they're contacted. They can be contacted a couple different ways. We can actually get notified of the information and contact them directly. The physician can write us a referral and say, you know, go ahead and set this person up. Can you contact them? Basically, though, once we contact them, we still give them a choice. Do you want to come in to us and have us set it up for you, or would you like to? If you're already getting oxygen from, say, Uptown Drug or Stat Medical, I don't know all their services, but if they're getting some other service, a lot of times, you know, they want to go to the same place, which I don't blame people. It's not going to hurt our feelings. We just want to make sure they're notified and understand that something's been identified that they might need a, you know, CPAP or BiPAP for whatever reason, and then give them that choice. So we want to make sure we identify and notify everybody out of the sleep lab, and then they can pretty much make their decision where they want to go.
Their choices.
And if they have any questions, Dr. Matheny, our primary pulmonologist, is we're going to start through this kind of CPAP setup, respiratory, you know, sleep therapy equipment. We're going to start a support group.
Oh, good.
Yeah. So we'll be meeting. I think they call it it's like kind of like a national thing. A lot of places have them. They're called awake meetings. Oh. And people can come in, bring their machines, do kind of a little check-in, ask questions. If there's a problem with something, we can check it out. You know, meet with the physician once a month, that kind of thing. So it's hopefully after we get this up and running after November 1st, we'll be posting it on the website.
Okay, good, great.
For the dates and times, and you know, that way they feel like they have that continuation of support. And, you know, meet other people, talk to them about how, you know.
How's that working for you? Or have you thought of?
Yeah. It's amazing how many people have gotten kind of creative on things, and you know, it's always interesting to talk to people that have been, you know, wearing CPAP or BiPAP for many years, and you know, kind of, you know, the different cycles people have of their lives, and how they've adjusted.
I always share with people my example is because I live off the grid, and you know, we've been building our home for a couple of years now, and so literally we live on a generator right now, and my CPAP runs off of a battery that I keep charged, and I have a special battery hookup that I had to get online. But well, that's something in the future you may want to look at too, because I'm sure I'm not the only one who lives off the grid.
You know, like the whole, we have a very large community of people that live in motorhomes. And you know, where are we going with that? I mean, plugging them into car lighters, and you know, using options. Yes.
Well, this is great information, Tony. I'm really glad you're on the show today. Just as a reminder for folks, if they have questions, want more information, they're going to call that 263-3911.
Yes.
Right?
That's a direct line. Yep.
And we'll have more information soon on our website, azkrmc.com. So we'll have, those are different options for the folks that they can call or check out on the internet, okay?
Yeah, because we're really excited about all these new services. Super. And, you know, if anybody has any questions or concerns or needs a referral form, they can call us.
All right. Well, thanks again, Tony, for being on our show.
You're welcome. Thanks for having me.
We'll talk to you soon. Take care. Thanks for joining us. Stay tuned for next week. We'll have another guest.